Trauma systems. What do we need to know about that? All right. Trauma system is a bunch of different cogs that create this system to manage patients that are injured in accidents or involved in trauma. Hawaii's trauma system stems from the state of Hawaii EMS, Emergency and Injury Prevention Branch, that branches down to the different county agencies. Here in Hawaii, it's you get Big Island Fire. We coordinate services with and to Hilo Hospital as well as Hawaii Air Ambulance to get them over, or an air ambulance provider to get them over to our Metropolitan Trauma Center. We do also augment that service by the use of military and Coast Guard when need be. Now, trauma systems began somewhere in the early 70s in the state of Hawaii. Prior to that, most hospital systems and community level public health agencies were directed under local county control. Since then, it's been the state's authority to manage these injured patients. Now, an injury and trauma itself is an accidental or unintentional issue. It's an incident that is mostly preventable. In not doing so, it's a very costly and heavy burden on the community and the health system at large. And so we instill injury prevention programs. We'll talk a little bit more about that soon. How do we determine these injury prevention programs? We collect data. This data and data points are in place by NHTSA, who is an agency under the Department of Transportation. These data points then transmitted down to state and our local levels. We end up putting this data into our charting systems, and we're able to pull that data up and look at it at a local level and design these injury prevention programs around those. And it makes us understand our basic strategies and knowing our highly susceptible patient populations to better develop our injury prevention services and strategies. When we look at these accidents or preventable incidences, we look at the pre-event. If we can somehow mitigate and stop the incident from occurring altogether, we serve our public better, and we don't have to worry about the actual incident itself. Some of these prevent strategies are like such as immunizations or CPR training. Also would be just a overall healthy lifestyle. But we do also have our child safety seats, helmets being worn when we ride motorcycles, bicycles, or skateboards, and even our water safety injury prevention. We also look at the event and if we could do anything and prevent or any type of mitigated strategies to minimize the issues surrounding the event. So this is the event strategies. In some of these cases, we may place an AED, perhaps at the athletic event, should one of the students or athletes succumb to sudden cardiac death. We also would implement our emergency action plans. And then lastly, the post-event strategies. Our post-event strategies are to make sure that all of these systems, the cogs, are all well working so that we can transport that patient to the critical trauma center. So it is a systems-based approach. All efforts are to look at mitigating the pre-event, event, and post-event issues. As far as trauma, there are some laws as far as the trauma and energy goes. We know that an object once exerted force upon itself will then start to, that motion or that energy and that force will continue in motion until it's abruptly stopped. When it is stopped, that energy is not destroyed, it's just displaced or transferred. That's where we look at that energy affecting our patients. And we know that the force is as much equal to mass and velocity. So something larger and traveling at a larger rate of speed leaves a larger, bigger hole. A lot more damage, a lot more displacement. Now, this displacement of energy occurs in three events. We have in this case, we'll use a motor vehicle. We have a motor vehicle come into, at a high rate of speed, come into an abrupt stop by a rock wall, another median, another vehicle, or a tree. That energy is not displaced, not destroyed, it's just displaced. Now the occupants within the vehicle are thrown about. As a result, the third impact would be the occupants in the vehicle, their organs get shifted about. So again, there's three impacts as a result of the energy being displaced. The vehicle coming to a complete stop, that energy being transmitted. The secondary impact not being the occupants or operator of the vehicle. And thirdly would be the organs and body parts of the occupants and the operator of the vehicle. Kinematics. Kinematics is the ability to understand the mechanism of injury and potentially understanding injury pattern. When we look at the types of injuries or mechanisms of injury, we can somewhat assume what type of injuries we would see. In blunt force trauma, we would tend to see a reddening over or ecchymotic area and bruising or edema over the area that was struck. As far as the damage internally, that would be dependent on the velocity of that blunt instrument as well as the size, how much compression and the duration of the energy that was applied. And then we'd have to ideally understand the mechanisms of that type of blunt force trauma, and then what lies underneath that area that absorbed that energy. So if it was in the abdominal area, we can see a displacement of that energy over the abdominal wall and soft tissue, and then injuring something further on in the abdominal contents or abdominal organs. Now when we go to projectiles create a little different type of injury pattern. It's usually a through and through. This is based on the size of the projectile itself, and then the load or the force that's coming out of the muzzle. Now there are low volume and there's high volume pressures, being a handgun versus a rifle. The higher the velocity and projectile, the larger the cavitational wound. This is a temporary wound path that, with the velocity of the ballistic profile, causes the tissue to expand around the projectile as it enters through the tissue. Some projectiles also have a different type of ballistic profile, which allows them to tumble raw and flip. Other ones tend to disperse or break apart upon impact. As we look at the motor vehicle accidents, we look at a frontal head-on collision. Frontal head-on collision will cause two types of injury patterns. One is an up and over, where the occupant, maybe unrestrained, will go up into the windshield, up into the dashboard, up into the steering wheel, causing upper torso and upper extremity as well as head and neck type of injuries. The second pattern would be down and under, causing lower extremity and pelvic fractures. Lateral impacts, we look at impacts on the side. This can cause a type of shearing and shifting patterns, looking at the neck, head, upper torso, and then potentially the pelvic girdle. Rotational and rollover patterns are even more difficult to predict, these type of injuries, just because these are more additional forces, and it's very unlikely to accurately predict the injury pattern. Although we should know that from our frontal, our lateral, and then I failed to mention the rear end type injuries, that we do have this type of whiplashing. Knowing those types of injury patterns can give us an idea that at least those forces were into play, depending on the rotational and rollover impacts. Hopefully what we mitigate in these accidents is the use of restraints and airbags. So we have lap belts, shoulder belts, and airbags. These are sometimes front and side airbags. These tend to disperse the energy and keep the occupant restrained. Although they are in place to mitigate injuries, they still do have some of their downfalls. Improperly worn lap belt can cause intra-abdominal injuries. to intestines and may ride high up and causing large solid organ damage. We can see improperly worn shoulder harness or shoulder restraints causing neck, clavicle, abdominal, or extremity fractures. Side airbags can be deployed, causing injuries to the face, neck, and because they're under high pressure and gas, there's also some burn and inhalation injuries. When we talk about our pediatric patients and infants, we look at them being placed in child safety seats. These child safety seats tend to prevent further injury, and we normally put infants in the rear-facing type safety seats. We have also front-facing safety seat. We also have high back and backless. These are more options for our slightly larger toddlers to younger children. Keep in mind that when we are evaluating the child safety seat, if we need to take the child out of there to assess if there are serious injuries. If the child safety seat is damaged and we assume that the amount of energy that was placed into this type of accident requires the patient or the safety seat to be separated from one another, we have to think about then securing the child in some other type of security device.